Good afternoon, everyone. My name is Sherelle Ross, and I am the newly appointed Mental Health Administrator for Urban Hope Behavioral Health and Wellness Center. I want to thank each of you for being here today as we discuss our draft business plan, organizational direction, and the ethical standards that will guide our outpatient mental health program moving forward. Urban Hope Behavioral Health and Wellness Center is a community based outpatient program dedicated to providing accessible, culturally responsive, and evidence based mental health services to underdeserved populations in our urban community. Our primary focus is improving mental health outcomes for adolescents, young adults, and families while promoting dignity, equity, and long term wellness. Today, I will review our organization's vision statement, mission statement, organizational goals, and discuss the importance of financial stewardship, including collections, accounts receivable, management, and maintaining healthy cash flow balances. I will also address a serious ethical concern related to documentation practices that directly impact organizational integrity and patient care. Urban Hope Behavioral Health and Wellness Center was established to address growing mental health disparities within undeserved urban communities. We provide outpatient counseling services, psychiatric evaluations, medication management, trauma-informed care, crisis intervention, and community outreach programs. Our organization was founded on the belief that mental health care should be compassionate, accessible, culturally competent, and ethically grounded. We recognize that many individuals face barriers such as stigma, financial hardship, transportation, limitations, and mistrust of healthcare systems. Therefore, our organization is committed to creating a safe and inclusive environment where clients feel respected and supported throughout their healing journey. As a leadership team, our responsibility is not only to provide quality clinical care, but also to ensure the long-term sustainability and ethical operation of this organization. So our vision statement is to create a healthier and more equitable community where every individual has access to compassionate, culturally responsive, and transformative mental health care services. This vision will reflect our long-term aspiration to reduce mental health disparities and strengthen the emotional well-being of the communities we serve. It reminds us that our work extends beyond treatment alone. We are helping build healthier families, strong communities, and better futures. Okay, now our mission statement is Urban Hope Behavioral Health and Wellness Center is committed to delivering accessible, evidence-based, and ethically driven outpatient mental health services that empower individuals, families, and communities to achieve emotional wellness and resilience. The mission emphasizes accessibility, ethical leadership, evidence-based care, and empowerment. Every decision we make as administrators and managers should align with this mission. As a part of our draft business plan, our organization has identified 5 primary organizational goals. Number 1 is to increase access to care. We aim to expand outpatient services by increasing telehealth availability, extending evening clinic hours, and strengthening community partnerships to reach underdeserved populations. Number 2, we want to improve patient outcomes. We will implement evidence-based treatment approaches, trauma-informed care practices, and measurable patient outcome evaluations to improve quality of care. Number 3, we want to strengthen financial sustainability. Our organization must maintain strong financial management practices to ensure operational stability, staff retention, and continued community service delivery. Number 4, we want to promote workforce wellness and retention. We will prioritize employee wellness initiatives, professional development, and supportive supervision to reduce burnout and strengthen organizational culture. And number 5, we want to maintain ethical and regulatory compliance. We're committed to maintaining the highest standards of ethical practice, patient confidentiality, documentation integrity, and regulatory compliance. Now I want to talk about the importance of collections, accounts receivable, and cash flow. So as leaders within a mental health organization, we must understand that compassionate care and financial responsibility go hand in hand. Without healthy financial systems, we cannot sustain staffing, maintain operations, invest in technology, or continue serving our community effectively. Now, timely and accurate collections are essential because they directly impact our ability to provide uninterrupted services. When claims are submitted correctly and payments are collected efficiently, we strengthen the organization's financial stability. We must ensure billing processes are ethical, accurate, and compliant with payer regulations. Ethical collection practices also protect client trust and reduce legal risk. Accounts receivable management is another critical component of financial health. Delayed reimbursements or unresolved claims can significantly impact operational sustainability. As a management team, we must regularly monitor aging reports, denied claims, and reimbursement timelines to ensure financial accountability. Strong communication between billing staff, clinicians, and administrators is necessary to prevent documentation errors and payment delays. Cash flow is the lifeline of any healthcare organization. Positive cash flow ensures we can pay employees, maintain facilities, purchase clinical resources, and continue providing patient services. Now, a poor cash flow management can lead to staffing shortages, reduced services, and organizational instability. Therefore, financial stewardship is not separate from patient care. It is directly supported by that. Now, as administrators, we must model transparency, accountability, and ethical financial decision making at every level of the organization. Okay, now, one of the ethical leadership principles I strongly believe in is integrity. Ethical leadership requires honesty, accountability, fairness, and transparency in all organizational operations. Our responsibility as leaders is not simply to generate revenue. Our responsibility is to ensure that revenue generation occurs ethically and legally while protecting patient welfare and organizational trust. This includes, but is not limited to, accurate billing practices, honest documentation, regulatory compliance, respect for patient rights, accountability for organizational behavior. Financial success should never come at the expense of ethical practice. Okay, now at this time, I want to address a very serious ethical concern that has recently come to my attention. It has been identified that some staff members have not properly documented services within patient charts in ways that may artificially increase reimbursement revenue. This includes incomplete clinical documentation, exaggerated service time entries, and insufficient justification for billed services. I want to be very clear. This behavior is unacceptable and it violates both ethical standards and healthcare regulations. Improper documentation compromises patient safety, clinical continuity of care, organizational credibility, legal compliance, and insurance billing integrity. Most importantly, it undermines the trust our community places in this organization. As your administrator, I am committed to addressing this issue through corrective action, additional training, and increased compliance oversight. However, I also want to approach the situation from a leadership perspective focused on accountability and improvement rather than fear. So moving forward, this is what we're going to implement. Mandatory documentation training, non-negotiable. Routine chart audits, compliance monitoring procedures, ethical leadership workshops, and open communication channels for reporting concerns. The goal is to create a culture where ethical practice is expected, supported, and reinforced consistently through the organization. Okay, lastly, I want to say that the Wellness Center has the potential to become a leading example of ethical community-centered mental health care. Our vision, our mission, and our organizational goals provide the foundation for sustainability, growth, and meaningful impact. However, our long-term success depends upon strong leadership, financial responsibility, and ethical integrity and teamwork. As members of this management team, each of you plays a critical role in shaping the culture and the future of this organization. I look forward to working collaboratively with all of you as we continue to build a program that prioritizes compassionate care, operational excellence, and ethical leadership. Thank you for your time, your leadership, and your commitment to serving our community.